Okay, so let's look at the teeth of the large animal. We need to consider the porcine real quickly here because the porcine are full-mouthed. Okay, so what we're seeing here with this nomenclature is that this is looking at one side, and we have the top teeth and the bottom teeth. So this is the half of the top arcade, and this is half of the bottom arcade. Okay, so we see 3 incisors, we see 1 canine, 4 premolars, and 3 molars. So that would be both upper and lower on each side. Okay, now when we start to see loss of teeth, we generally see loss of the premolars from the front, so we'll lose premolar 1 first. And when we see loss of molars, we'll lose them from the back. Okay? So let's look at a horse. Okay, so the deciduous teeth in the horse, we're going to see in the young, we see 3 incisors, we see no canine teeth, and we have 3 premolar teeth. One thing to remember is that the molar teeth are always permanent teeth. They're never deciduous teeth. Okay? And then because we have 3 premolars, that means instead of the 4 that would be normal, we have lost the first premolar. Okay? In the adult, so the permanent teeth, we're going to see once again 3 incisors. We may or may not see canine teeth. Okay? In most cases, it is a male that has the canine teeth. The females usually don't. Okay? Notice here for the premolars, we say 3 to 4 premolars on top. That is because in some horses we'll see premolar 1, which is what's known as the wolf tooth. Okay? And often this wolf tooth is removed because some people believe that it's going to interfere with the bit. So with this nomenclature, let me give you an example of how you would write it. So if you're talking about the upper 4th premolar on the left, you would put your premolar, your P for the premolar, your 4 for your 4th premolar, and then you'd put that 4 on the upper left to indicate that's the upper left. Okay? What is being used more commonly now is the modified Trident system. Okay, once again, it's based on a full dentition of 44 teeth. The teeth are numbered by quadrant. So we start at the upper right with 100, left 200, lower left 300, lower right 400. So essentially we are going from your left to right, but it's going to be the horse's right to left, and then down, and then back across. So you're kind of going in a circular pattern here. Okay. So then you number the teeth, starting with the central incisor as being number 1, canine being number 4, first premolar number 5, and the last molar is number 11. Okay, just as examples. So a good example here to use is our upper first premolar. In this case we have a wolf tooth, so that would be 105. Okay, now we don't have a lower wolf tooth, premolar 1, but we would count the rest of the premolars as if we did. And so in the absence of a wolf tooth, we're going to start with premolar 2, premolar 3, and then premolar 4. Okay? Okay, so I say here the second and third digit, we're starting with the first incisor. If it is less than 10, then that second digit is 0. So as we see here, 406 versus 46. Okay? Okay, let's talk about the surfaces of the teeth. Okay, we're going to outline that tooth there and that incisor up there. Let's first talk about the occlusive or masticating surface. Okay, so the occlusal surface is where the 2 teeth from the upper and lower arcade come together. So the outer surface of the tooth is the vestibular surface. Now this can be divided into a buccal and a labial portion. Okay, so if we're more specific with a given tooth, such as when we're talking about the cheek teeth, which are the premolars and the molars, down here at the cheek, that outer surface is the buccal surface, okay? Whereas up at the incisors, that vestibular surface is the labial surface, okay? But in general, they're both vestibular surfaces, okay? Now the inner surface is related to the tongue, and so we refer to that as the lingual surface, okay? Now if we were to divide it in half here, and then kind of take it so we are going instead of back this way but more outward. So if we straightened it out so it was going out like this, okay, we would see that that surface towards the midline, that is going to be referred to as the mesial surface. Okay, so in green, I'm going to mark the mesial surface of this tooth, mesial surface of this one, and then this one, this tooth, and so forth. Okay, so those are the mesial surfaces. And because that's towards the midline. But away from that midline, we then have the distal surface. And so if I do the distal surface, then in pink, we would see this would be the distal surface here, 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 and there, and there. Okay? Okay, so here now we have a tooth that has been cut in half. Okay? So the hypsodont teeth, which are all of the horse's teeth, as well as the cheek teeth in the bovine, they're sometimes referred to as continually eruptive. They've got a very high crown and a low root. Okay, and we see that on the outer surface is cementum. Okay, so we have this cementum covering the whole outer surface, and then deep to that we see the enamel in white here. And notice we have this invagination right here. Okay, this invagination of the enamel is known as the infundibulum, and that infundibulum contains cementum. Okay, from the surface we refer to this here, this space, as the cup. Okay, so why do we have this infolding? We notice even more of that on the cheek teeth. This would, because we have enamel there, that gives more surface area and more enamel for the grinding purposes. Okay, let's go to this image here. Okay, so as we begin to wear these teeth down, you see that right here, we've worn off that dentin, we've now encroached upon the enamel, and now this tooth is considered in wear. This occurs about 6 months after eruption. That's going to be an important thing to remember. So about 6 months after eruption of the permanent teeth, we see that they are in wear. Okay, as that continues to wear down and grow out, we're going to see that now we've got that whole surface here that is in wear, and so this is known as level. Notice we can still see the infundibulum here. Notice as we wear this down further and further, we may encroach upon our dental pulp right here. Okay, we don't want to encroach upon that, and so what happens is as this erupts, we're going to have new dentin laid down in this space here. Okay, so when we finally do get wear down to this level here, we're going to start seeing a dark spot So we can see over on this image here, we see this dark area right here, and that's going to be the dental star. Okay. Now we look here and we can see the difference between the deciduous and the permanent teeth in the horse. The deciduous teeth are very cup-shaped or spade, shovel-shaped. Okay. Whereas the permanent teeth are more square, more columnar in shape. Okay. So let's start out with this young horse here. We see the first deciduous teeth erupting. This occurs at birth to 2 weeks, and we're going to kind of round that to 6 days. You'll see why in a bit. Notice also that the deciduous premolars come in within those first 2 weeks as well. Okay, starting with premolar 2, then premolar 3, and premolar 4. Okay. When our second deciduous incisor erupts is 4 to 6 weeks. And so we're going to just round that to 6 weeks. See a trend here? And then here we see the eruption of the third incisor. This one generally erupts 6 to 10 months. And so we're going to just kind of round that to 6 months. Okay? So we have 6 days, 6 weeks, 6 months. This is a very easy way to remember the approximate times that these deciduous incisors are going to erupt. Okay? We're going to find that the cheek teeth can help us in aging these that are between the time that the deciduous teeth erupt and the permanent teeth start to erupt. We look at this set of teeth and we see now we have much more square looking teeth coming in. Okay, these are going to then be the first set of permanent incisors. Okay, so in permanent incisor 1 is going to erupt at 2.5 years. Remember that wear is going to occur 6 months later, so the horse would then be 3 years old. Okay. Now in this next image we see that the second permanent incisor has erupted. So eruption time for the second incisor is going to be at 3.5 years. And so the second will be in wear at 4 years old. So here we see now eruption of our third incisor. So eruption of the third incisor is going to be at 4.5 years. And they're going to be in wear at 5 years. So of the permanent incisors, we see eruption at 2.5, 3.5, 4.5, with wear being at 3, 4, and 5. Okay? I mentioned that the cheek teeth are going to help us in aging that first and second year. Okay? Canines are generally going to come in at 4 to 5 years, and generally only in the males. Okay. Premolar 1, if it is going to be present, comes in at 5 to 6 months. But our premolar 2 will come in at 2 years. Premolar 3 at 3 years, premolar 4 at 4 years. Okay. Remember the molars, they are only permanent teeth, and the first molar comes in at 9 to 12 months. Okay, so you can look for that as well as your eruption times of your deciduous incisors, kind of get an estimate of about a year. And then the second molar comes in at 2 years. So both premolar 2 and molar 2 come in at 2 years, so that can help you with the 2-year range. And molar 3 is going to come in 3.5 to 4 years. Okay. Notice here I said that the fourth premolar comes in between 2 permanent teeth. Okay. Occasionally it has trouble coming in, but usually it's pretty fine. Okay, so we are full-mouthed at 5 years. Okay, on to the bovine. Remember that the incisors and the canines are going to be brachydont teeth, whereas the cheek teeth are going to be hypsodont. So we look at the dental formula for the deciduous teeth. Notice that we have no upper incisors or canines. So we have 3 lower incisors, and the canine is going to look very much like an incisor. And once again, we're going to have 3 premolars. So we are missing the first premolar. And remember, molars are never deciduous. They're always permanent teeth. So we look at the adult and the permanent teeth. We have, once again, 3 lower incisors and 1 lower canine on each side. We have 3 premolars and 3 molars. When we talk about the teeth being in wear, you can see that in wear is very similar to what we see in the equine. We just get this region here is starting to wear down. Okay. But when they are level, we're going to see that wear comes all the way to the lingual surface. Okay. So that's a little bit different than what we said in the equine. So here we have side by side deciduous and permanent teeth. We number them first incisor, second incisor, third incisor. And as I mentioned, the canine teeth look just like incisors. Okay. Generally, the incisors are going to erupt from birth to 2 weeks. The canine usually in that same time, maybe a little bit longer, like the 3 weeks. Okay, so then we start really being able to age the animal when the permanents come in. Okay, so notice how much larger the permanent teeth are. So our first permanent incisor is going to come in at 1.5 to 2 years. So that's the eruption time. Then our second permanent incisor is going to come in at 2 to 2.5. So we had 1.5 to 2, 2 to 2.5. Our third incisor is going to come in at 3 years. So we had 1.5 to 2, 2 to 2.5, 3 years now. And then finally, our permanent canine tooth is going to come in at 3.5 to 4 years. So these guys are considered full-mouthed at 4 years of age. All teeth in wear by 5 years. And we can only estimate above 5 years. Okay, I want to go back to something here. Okay, at this age here, we noted that it was 2 to 2.5 years. Okay, so if we put that in months, this is going to be 24 to 30 months. Okay, so aging cattle to 30 months is important in exporting internationally because of mad cow disease. It is thought that animals under 30 months of age are not affected by this disease, and this is right around the slaughter weight as well. Okay, being able to age these animals is important also for brucellosis vaccination and bleeding, as well as for aging for cow bull sales. Okay. Okay, so looking at the eruption time of the cheek teeth, the deciduous premolars 3 and 4 may be present within the first 2 days after birth. Okay. Premolar 2, generally birth to 2 weeks it will come in. We're going to see that the first molar comes in at about 8 months, the second at 12, and the third at 24 months. Okay. And then the permanent premolars are going to come in at 2 to 2.5 years, 1.5 to 2 years. No, that's not backwards. That is how they come in. So that one comes in first before the second premolar. And then we get premolar 4 coming in. Once again, premolar 4 is going to come in between two existing teeth. Okay, that's all I got.